Fox 13 presents Healthier Together, sponsored by Regence Blue Shield.
Tomorrow is the start of Black Maternal Health Week, and Black mothers are 4 times more likely to die during childbirth than white mothers. In this week's Healthier Together, we hear about ways we could improve outcomes for Black moms.
I'd like to share a fact that might blow your mind. Hi, I'm Dr. Nicole St. Clair. I'm the Executive Medical Director for Regence Blue Shield in Washington, and I'm an OBGYN. According to the World Health Organization, high-income countries like the U.S. typically have a maternal death rate of about 12 per 100,000. Then if you take a look at Black moms in the U.S., we find the maternal death rate to be 55 per 100,000. So way higher and a huge problem. We really need to sound the alarm for this. This week is Black Maternal Health Week. This was something that was founded in 2018 by the Black Mamas Matter Alliance. And the reason that we even have this week is it's really important to shine the light on the fact that we have really worrisome and unnecessarily bad outcomes for all moms in this country, but especially Black moms. There's no fundamental difference in the way our bodies work amongst the races. So when we see a difference in health outcomes, we have to really ask ourselves, why would that be? There are lots of layers, starting with certain kind of societal factors and kind of just the legacy of racism in America and the way that that has been experienced by Black women. Then you add in some of those health problems with additional barriers, a greater rate of housing insecurity, food insecurity, you know, kind of some of the ways that our social safety nets we may fall through. And then there are other layers that are happening just within the healthcare space itself. So we know from studies that healthcare providers, whether conscious or unconscious, can have biases that affect their care and lead to differences in the way that they treat pregnant women. We know that Black moms, when they're having health challenges or concerns, are more likely to feel that their concerns are dismissed by their healthcare team. And if you even look at the case of Serena Williams, a person who has kind of all of the resources at her disposal and also is well known, she too had a pretty significant pregnancy complication that could have been recognized earlier and potentially even avoided. There really is a role in both educating yourself and arming yourself with tools and resources. Part of that is understanding your own health, having clear communication with your healthcare team, talking early on about what to expect, what your hopes and concerns are, and if you're feeling like your needs aren't being met or your questions or concerns aren't being answered, really revisiting and coming back to them. In the current state of affairs, Black moms have a 3 to 4 times higher risk of death than white moms, and for this reason, we have to bring attention to this issue, and that is why we have Black Maternal Health Week. So if you take anything away from what we've talked about today, please know that this is a significant problem that requires urgent action and attention, and that there are ways we all can contribute and help, whether that is bringing awareness, supporting the cause with our time, energy, resources, or within the healthcare system ourselves, taking time to look and see where we can affect change.
We do have a reminder for you. You can find all of our Healthier Together reporting on fox13seattle.com.